depression is a grave mental health concern in our society. Around 300 million people globally suffer from depression. In India, this number is estimated to be around 5% of country's population. The traditional medication used for depression is known to take days before it shows its effects. However, a new form of medication is being used nowadays, which is believed to be more effective and quicker as compared to traditional drugs. But researchers are still studying the mechanism of this new form of medication.
Traditional antidepressants such as SSRI take around 3 to 4 weeks to show their effect. But recently, people are using ketamine, which is traditionally used as an anesthetic drug. But if we use as a sub-anesthetic dose of the ketamine, it can also serve as an antidepressant. And the effect of ketamine is really great. It's a very game changer. Just after 24 hours, it's showing its effect that it's working on the depression.
The mechanism of ketamine is still relatively unknown to scientists. It has been shown that ketamine affects the emotional area of our brain, which is interlinked with depression symptoms.
In our study, we examined that how ketamine is affecting our emotional processing using a behavioral paradigm. It's called startle reflex paradigm. So startle is a response for any sudden noise. It can be a sound. So let's say if a sudden pin drop sound in a negative environment, or when we are watching a horror movie, we feel very large response as compared to when we are in a good mood.
In depressed people, there is no startle response to an external stimulus, neither positive nor negative. However, antidepressants help in regaining this startle response.
So in our study, we administered ketamine and then performed this affective modulation of startle reflex paradigm, where we showed positive, negative and neutral images and then give the startle reflex, and we measure the eye blink response, which is here, because whenever we give some response, we show construction in our muscles. So if there is a more startle, there is a more muscle reflection, and this reflection is automatic. So in our study, we gave the ketamine and then measured these reflexes, and we have been shown that this ketamine is making positive reflex higher as compared to neutral reflex.